Is health insurance keeping you employed? Would you like to retire but don't know what to do about health insurance before Medicare starts? Well, congratulations on taking steps to prepare for retirement and being diligent so you can retire early. Retiring before 65 can leave a potential gap in health insurance coverage. We will discuss some options that are available to help bridge that gap. This period of transition calls for careful considerations and proactively planning to ensure uninterrupted access to comprehensive health care. Without suitable health insurance options in place, retirees may face unexpected medical expenses that could jeopardize their financial security. By exploring and securing appropriate health insurance coverage tailored to their specific needs, individuals retiring before 65 can effectively protect their well-being, gain peace of mind, and confidently embrace the next chapters of their lives. I'm Jacob Hartke, Wealth Advisor at Sweet Financial Partners located in southern Minnesota. We specialize in working with high net worth individuals as they navigate life's biggest financial transitions through our trademark Dream Architect process. One of the biggest questions retirees face is health insurance and finding the options that are right for their unique situation. We have been able to help numerous clients retire before 65 by focusing on things that they can control, like structuring their income accordingly. Meet Sarah, who had spent decades diligently working towards her dream of retiring early. However, there was one significant concern that weighed heavily on her mind: health insurance. Sarah always assumed that she would have to work until 65 to maintain her health insurance coverage. But as she delved deeper into researching her options, she discovered an empowering solution. Sarah connected with our team and we helped her through our Dream Architect process, where we were able to explain that by proactively structuring her income and making strategic financial decisions, Sarah could potentially qualify for valuable tax credits. These credits would significantly reduce the cost of health insurance during the interim period before becoming eligible for Medicare. With a renewed hope and determination, Sarah worked closely with us to develop a comprehensive plan. We analyzed her financial situation, taking into account her retirement savings, investments, and other income. By strategically adjusting her income and carefully managing her assets, Sarah was able to optimize her financial situation and qualify for substantial tax credits. As Sarah bid farewell to her working years and embarked on her well-deserved retirement journey, she did so with a newfound sense of freedom and security. Thanks to her diligent planning and guidance of her trusted advisors, she not only achieved her dream of retiring early, but also bridged the health insurance gap seamlessly. Sarah's story serves as an inspiring example of how careful planning and expert guidance can transform the retirement experience. By taking proactive steps, she was able to retire before 65 without compromising her access to comprehensive health insurance coverage. Sarah's journey reminds us that with the right resources and support, retiring early is not just a dream, but a tangible reality that can be achieved while ensuring essential health insurance protection along the way. There are many options available as you look to bridge this gap. Your first option, and we strongly encourage you to check with your current employer to explore if they offer special health care benefits for retirees. Although the policy or coverage may vary from the active employees receive, it has the potential to provide equally or even better coverage at a comparable cost to the retiree. Unfortunately, retiree health coverage like this is rapidly diminishing across the corporate landscape. With the exception of certain public employees such as government or school districts, the majority of companies no longer extend free or subsidized health insurance to retirees. This shift in the industry has made it increasingly challenging for retirees to secure adequate health insurance coverage. While this may be disheartening, it's worth noting that there are still some companies that maintain legacy plans designed to cover individuals who have already retired or nearing retirement. However, as a general trend, the availability of these such benefits is decreasing for younger individuals. If you are fortunate enough to have access to one of these special health insurance benefits through your employer, it may represent your best option to ensure comprehensive coverage before turning 65 and enrolling in Medicare. It's crucial to seize these opportunities and evaluate the terms, coverage, and costs associated with the retiree health care packages, as they offer a viable solution to bridge the gap until you become eligible for Medicare. We understand that navigating the complexities of healthcare coverage during retirement can be overwhelming. Our team is here to help support you, provide you guidance and personalized assistance in understanding your options and making informed decisions regarding your healthcare coverage. Don't hesitate to reach out for further information and clarification. Remember, taking the initiative to explore these retirement health care benefits with your current employer can potentially yield significant advantages and ensure your health and well-being are safeguarded during this transitional phase of your life. Another potential option to consider if you're married is that this opens up the possibility of obtaining health insurance coverage through your spouse's employer-sponsored plan. Many employer-based plans extend coverage to spouses, children, and certain dependents, offering a valuable opportunity for you to be included in the plan. One significant advantage of spousal coverage is that employers often subsidize a portion of the premium, making it a cost-effective choice for you. This means that the financial burden of obtaining comprehensive health insurance can be significantly reduced. Another notable benefit of spousal coverage is that these plans typically do not require medical underwriting. This means you may be automatically eligible for coverage without having to undergo a physical exam or do any other medical testing. This streamlines the process and simplifies the enrollment process and ensures that you can obtain coverage without any additional hurdles. It's important to acknowledge that spousal coverage relies on the presence of your working spouse who has access to the employer-sponsored health insurance. Unfortunately, if you don't have a spouse or if your spouse does not have access to such coverage, this particular option may not be applicable in your situation. However, if you do meet the criteria, exploring the possibility of obtaining health insurance through your spouse's employer-sponsored plan can be a practical and advantageous choice. The combined benefits of subsidized premiums, eligibility without medical underwriting, and access to comprehensive coverage make spousal coverage a compelling option for those retirees before 65. Another option to consider is extending the coverage that you have through your previous employer through COBRA. COBRA allows you to maintain the exact policy and coverage you had while you were employed, providing a seamless continuation of your health benefits. One of the advantages of COBRA is the absence of medical underwriting as well, which means you can retain the coverage without needing any medical exams or finding any new medical providers. You can continue receiving care from the same doctors and healthcare facilities as before, making this transition even smoother. Additionally, COBRA allows you to cover your spouse and children, ensuring their health needs are also met during this time of transition. However, it's important to note that COBRA may not necessarily be cost-effective compared to other alternatives. While employed, your employer typically subsidizes a portion of your monthly premiums, reducing your out-of-pocket expenses. However, once you retire and opt for COBRA, you lose this subsidy, resulting in higher premiums. In fact, you'll be responsible for paying the full sticker price of the policy, potentially making COBRA more expensive than other options. Another consideration is the limited duration that COBRA can cover. In most cases, it allows the extended coverage for up to 18 months after retirement or separation of services. However, it's important to plan ahead, assuming that you only have 18 months of coverage through COBRA. If you retire early, this means you may still have several years during which you'll need health insurance before being eligible for Medicare. Considering these factors, it's essential to evaluate the cost and duration of COBRA coverage in relation to your specific retirement timeline. Exploring alternative options and providing more affordable and extended coverages beyond the COBRA period may be beneficial in ensuring seamless healthcare protection until Medicare is available. Another option would be simply shopping around and purchasing your own health insurance policy. There are a few ways to approach this. One option is to work with a health insurance broker who can assist in obtaining prices, quotes, and comparing policies on your behalf. They have the expertise and resources to navigate the insurance market and find suitable options for you. Alternatively, you can directly contact health insurance companies via phone or email to inquire about individual health policies. It's worth noting that not all insurers operate in every state, so you need to conduct extensive research to identify insurers willing to provide quotes for your location. Dealing with a broker or conducting this search on your own can be time-consuming and involve sifting through numerous providers and plans. Additionally, if you pursue this option, you may be subject to medical underwriting, which could result in higher premiums or potential denials if you have pre-existing conditions. However, there's a simpler way to shop for private insurance independently. You can utilize the government-run health insurance marketplace or exchange, accessible at www.healthcare.gov. This platform facilitates the process of shopping for health insurance through the marketplace. You can determine if you qualify for enrollment and explore various plans. Generally, individuals can sign up for health insurance through the exchange during the annual open enrollment period at the end of the year. However, if you lose your employment-sponsored coverage due to retirement, layoff, or voluntary separation, you qualify for a special enrollment period. This allows you to enroll in coverage within 60 days of losing your employer sponsored insurance. It's important to understand that while government exchange aids in the shopping process, the insurance you obtain is not directly from the government. The marketplace serves as a platform that connects you with private health insurers. Ultimately, you will purchase a policy directly from a private insurer. However, policies you obtain through the marketplace must adhere to specific requirements and cover certain health conditions. One significant benefit of policies in the marketplace is that they do not require medical underwriting and cannot deny coverage based on pre-existing conditions. While this is advantageous for those who in need of health insurance, it may impact the affordability of the policies. Fortunately, policies in the marketplace offer different levels of cost sharing, allowing you to select plans that align with your needs. These plans are categorized into medical tiers such as bronze, silver, gold, and platinum, each offering different levels and cost sharing arrangements. Exploring the options available on the exchange can simplify your search for private health insurance. While the policies may come at a price, the marketplace ensures certain protections and broad coverage are available. The final option to consider is self-insurance, which involves foregoing any kind of health insurance coverage. This approach entails that taking the risk of going without insurance and being solely responsible for 100% of your medical expenses if you become sick or require any form of medical care. While this is technically an option, it's crucial to understand the potential dangers and risks associated with this choice. Opting for self-insurance can be a highly precarious approach to maintaining your healthcare needs. Without the safety net of insurance, you may face significant financial burdens, potential hardships in the event of an illness, injury, or medical emergency. The cost of medical treatment, procedures, hospital stays, medications, or even routine checkups can accumulate rapidly and become overwhelming, potentially leading to a financial strain or even bankruptcy. Furthermore, self-insurance leaves you vulnerable to the unexpected healthcare expenses that can arise at any time. Even if you are in good health, currently unforeseen circumstances can occur, and without insurance, the burden of these financial expenses falls entirely on your shoulders. It's crucial to consider the financial consequences and the impact they may have on your retirement savings and overall financial stability. Given the risks involved, it is important to note that self-insurance is generally not recommended by healthcare professionals and financial advisors. The purpose of health insurance is to provide financial protection and access to necessary medical care when you need it most, offering peace of mind and a sense of security. By obtaining appropriate health insurance coverage, you can mitigate the financial risks associated with unforeseen health issues and ensure that you have access to the necessary healthcare services without facing exorbitant costs. It is strongly advisable to explore alternative options for obtaining health insurance coverage, such as those mentioned earlier, which can provide you with the necessary protection and support during your retirement years. Investing in health insurance ensures that you have access to quality healthcare, preventative services, and necessary treatment without the added stress of the financial burden. Retiring before 65 is a huge milestone that not everyone can achieve. If you want to learn more about one of the strategies available to you now to help make this possible, check out Maximize Your Retirement Savings, Balancing Roth Conversions and Contributions, a video by Oliver Kolofsky, another one of Sweet Financial Partners Wealth Advisors.